Hey everyone, this is Christy Wright with Libertas Physical Therapy, and I wanted to create a video for you today to learn a little bit about pelvic health, to know some signs that I look for as a physical therapist, but when you might actually need a little bit of treatment or a little bit of help, or some things just to know more about your body and know what is normal and what is improvable. So we all know that your pelvic floor is kind of the base of your body. Your hips are connected to it and your stomach is connected to it, and the pelvic floor really supports a lot of your organs, and it can take a lot of impact. When we're learning to walk, we're falling, we're hitting our tailbone, we're doing all those things, and so the pelvic floor is really not something to ignore. So what I'm going to do is I'm going to show you as a physical therapist what I look for in my pelvic exam, and then teach you some little things to kind of check out on yourself to see if everything is as it should be, or if you might want to, have an exam done by a physical therapist or a physician that specializes in this. So I'm going to teach you a little bit about the pelvic floor. So when we do an exam, we'll always get a full history. We want to know if you have had children, if you have pain with intercourse, if you have issues fully emptying your bladder. So what that can look like is, oh my gosh, I can go pee all the time on command. Well, if you can pee on command all the time, you're probably not fully emptying your bladder. Or I have to rush to the bathroom or I'm going to leak. Leaking urine at any time, even when you're coughing and sneezing, that's a sign of pelvic dysfunction. We should be able to hold that in. Now, if you are, a crazy gymnast and you're doing a bunch of stuff and you've just had a baby, that's different. But just normal day in and day out, sneezing, coughing, jumping on the trampoline, you should not be leaking. Also, bowel problems, if you're like, man, I feel constipated all the time. I feel like it's there, but I can't push it out. Or, man, when I go to the bathroom, I am wiping and wiping and wiping. That's a sign of a rectal prolapse. Pressure in the rectum or multiple wiping or feeling like you can't fully empty, those are all pelvic floor dysfunctions that are absolutely treatable and something that you don't have to live with. Also, leaking bowel. It can absolutely happen, and it is absolutely treatable. So I'm going to show you guys the anatomy of the pelvis and some of the things that I look for and some things to kind of check out on yourself. And I really feel like the more you know, the more you know. And so then you are going to be your biggest advocate because you have this one body and it's absolutely amazing. So I want you just to be empowered and to know how it works. So in a pelvic exam, what we will do, other than, like I said, take the history, is we're going to do an external exam first. So the outside of the pelvic floor, let me pop ours back on here, is we'll obviously look at the skin. We're going to look at hair. We're going to look at tissues. We're going to look at the color of the skin. Now, outside the pelvic floor, you'll have your labia majora, which is the more external outside, and then the labia minora, which is typically the inside. We say majora and minora because that's how they're named, but often the inside of the labia will protrude outside of the external ones, and that is totally normal. Also, skin color. It is common that the skin of the pelvic area is a different color than the rest of your skin. Now, if you have noticed that your skin has drastically changed colors, or if it's abnormal, or if it's a rash, that's absolutely something to get looked at. But by no means should the color of your pelvic floor or the external be the same color as, the skin on your face. That it's just not the same type of thing. So what we're going to look at is, like I said, we'll look at the tissue of the labia majora and the labia minora. We'll also open up and we will look at the skin that glides along the clitoral hood, and then we'll look kind of around the urethra. We'll look for skin color. We'll look for moisture. The skin color of the labia minora and around the opening of the vagina, it can tell us a lot about hormones. If it is very pale in color or a significantly lighter color than some of this external area, that is a sign that maybe your hormones are a little bit off. So we'll talk about that as well. And we're also looking for moisture. So the pelvic floor is a self-cleaning machine, and that is good, orgasms and your typical monthly cycle. It maintains a certain pH. And so those are things that we don't recommend, doing a lot of scented things or external cleaners, because she can clean herself. So what we're going to do is we're going to look at the muscles of layer 1. And layer 1 can be seen externally through the skin, but as a physical therapist, I would also palpate these muscles. So we're going to look at the bulbocavernosus, which surrounds the vagina, and it opens and closes the vaginal opening. We're also looking at the ischiocavernosus, which helps with the clitoral erection. So your clitoral hood is here, and then here's your urethra, and here's the opening of the vagina, and then here's the rectum. And you see how these muscle fibers, they kind of go all the way around, because the pelvic floor, it's kind of a teeter-totter. We're constantly doing pressure changes in here. And so it's just really amazing how it all works out. And then the superficial transverse perineal, it stabilizes the pelvis. So this is kind of this ridge here that you feel. So in case so you want to know where we're at, here's our typical pelvis. And then you'll have, here's your booty cheek back here. So lying down here would be your little, butt cheeks, your gluteal folds as we call them. So this is layer 1. It can be palpated externally. So we're going to kind of look at the bulb of the clitoris, because as the clitoris gets engorged, as you get, aroused, the clitoris will actually kind of go back in her hood, and the bulbs will swell. And then these muscles here will help with the clitoral erection. And so this is why, one, you definitely don't want any sort of penetration until your body is really ready, because these muscles help open and close the vagina, and they really help with tissue flexibility as well as the lubrication. You need lubrication and you need tissue flexibility. When you don't have those, that's when you get tears and that's when you get irritation. So we will check that externally, but we'll also check it internally. And when we check it internally, this is a really small area. So we're looking at about maybe fingernail depth, and we kind of check everything like a clock. Layer 2 is more deeper in here, and it's about first knuckle deep, and that is the things around the vagina and then around the urethra. These muscles, the sphincter urethra vaginalis and the compressor urethra, they open and close the urethra and they pull it back up against the vagina. So these are the muscles that we really want to fire, because you need them to be able to fully empty or open and close the urethra. Layer 3 is about second knuckle deep. And so I'm going to take this off. And these are those deeper pelvic floor muscles. These are the ones that are for shock absorption. These help support the organs. These help with slinging everything together where the rectum comes through. So just for anatomy wise, your bladder would sit right here behind this bone. And then you would have uterus and ovaries in here. And then the rectum would kind of come back through here. And if you have a lot of muscles that come through here, but for this video, we're just going to do actually the pelvic bowl. So what we're going to kind of talk about here is we have the pubococcygeus muscle goes from the pubic bone back to the tailbone. And the pubococcygeus, it's kind of a ledge in there, and it supports the pelvic organs. And then we have the obturator internus, which is kind of this guy. And the obturator internus, it is a hip rotator. And so this is, you actually need, if you get that deep hip pain with hip rotation, sometimes that's tension in your obturator internus. Then you also have your coccygeus, which is around your tailbone, and it flexes the tailbone and kind of moves it side to side. It's kind of a little chunky muscle. It doesn't do major movements. Your tailbone doesn't get major movements. But when you get tension in your tailbone, that guy can be kind of the reason where you're like, oh, I just feel fullness on my tailbone. Sometimes it's that guy's in spasm. And so these muscles all form this big pelvic sling. And so when a baby comes through, or even if you're having a cesarean or any sort of trauma or any sort of intercourse, you're getting tissue, or you're getting tension on different parts of these. And so even with a cesarean, what they'll do is they'll cut you in here, but you can still have trauma to these muscles because baby's been sitting there for 40 weeks. And so these are all things, if you're having deep hip pain that won't go away, deep tailbone pain, or if you're feeling a fullness, or if you're feeling like, I can't empty my bladder, or I could pee at any time, or leaking in urine, all of those things. Those are all signs of pelvic floor dysfunction, and those are all super treatable. You just have to have someone who knows what they're doing. So I will say, kind of a quick rant I have is that a lot of times people will say, I just need to do my Kegels. Well, a Kegel is where you're taking these pelvic muscles and you're tightening them. But if these pelvic muscles are already so tight that they can't relax, doing a Kegel is going to make things way worse. So I always say, before you're Kegeling your mind out, you need to know where your pelvic floor is. Because if your pelvic floor is an elevator, ground floor is where you need to live all the time. Now, when you do a Kegel, or let's say you're getting ready to sneeze and you're like, oh, I don't want to pee, you're going to lift your pelvic floor. You can also do that, when you're aroused and you want to kind of feel more pressure, you can lift the pelvic floor. Whenever you are going to the bathroom, whether you're having a bowel movement or urinating, you're going to drop the pelvic floor. So you're going to leave ground level, you're going to drop it out. If you're going to push a tampon out, if you're going to push a baby out, you're going to drop the pelvic floor. Now, if those muscles are always kind of on ground 2 and you can't get to ground 1, then those muscles will feel really weak or they'll feel really tight and you can't even fully relax. And when you can't fully relax, that's when you can get an injury. That's when you don't have good shock absorption, or vice versa. If you can't leave ground level because you're so weak or you've had nerve damage and you're just like, yeah, I'm right here and you can't contract, those are things that internally we can cue and give you, say like, okay, we need to push here, or then you might want to do, they'll have like neuromuscular stimulators that we can put in to teach you. And then sometimes your pelvic organs, if they drop too much, then your muscles have a hard time holding them all up because they're really working hard. 60% of women who have had 2 births have some sort of prolapse, and that's when the organ starts to come forward or come down. That doesn't mean they're falling out. It means they're not where they are most anatomically pleasing, efficient. So we talked about already what a rectal prolapse looks like. It's multiple wiping, pain in the tailbone, and then a bladder or vaginal prolapse will kind of come down, and it is hard to fully empty your bladder. And it's really hard sometimes too, because if you're not fully emptying your bladder, then you're at risk of getting UTIs or bladder infections, and that can go up into a kidney infection. So those are things that I'm looking at. So you should never leak. You should not have pelvic pain. You should be able to have an orgasm. You should not be having a lot of infections. Those are things that you need to know. Also, you need to know the clitoral bulbs and the size of the clitoris is amazing. So you need to give her all the attention, not just right at the hood, because if you overstimulate the hood, it can cause tension in the pelvic floor and she'll just hide away from you. So I hope you learned a lot from this. If you have any other questions, you can always reach out. We're at libertaspt.com, and I hope you all do well and learn more about your bodies.